I've got less and less energy in me every single wave. Each time more patients come in, we feel like we get a little bit of a break, but then it hits us again and we're in disaster mode.
Julie Butterworth is an intensive care nurse at one of Sydney's biggest hospitals. Her mask-induced sores give you an idea of just how taxing the past 2 years have been.
There are times when I sit down and I actually think about how I'm doing, and it becomes too real for me, and I've actually got to deflect that. I was burnt out a long time ago. I'm emotionally numb a lot of the time.
Things happen that are unexpected in hospitals, and that burden and that pressure is just so much for someone to take. So the anxiety itself of the unknown is there before you even arrive at work.
Amy Halverson had her last shift at the Westmead Hospital a fortnight ago.
I don't believe the healthcare system was prepared by any means. There was absolutely no excuse that healthcare workers who are being told to go to work every day as close contacts and work and live with vulnerable people outside of the hospital didn't have rapid antigen tests available to them.
Despite the stress she's under, Julie continues to put on a brave face at work, not for her own well-being, but for those she's helping.
There are times when you'll have really human moments with your patients, and that can be something really, really small, and it just sort of sets you off. And you have to sort of walk out of the room, mostly because when you cry, your goggles fog up and you can't see anything. I had a patient once who was intubated, so he had a breathing tube in, and his family were on the phone. They were just praying with him, and I could see him praying with them, even though he couldn't speak. I'll always remember that one.
Julie says caring for COVID patients requires a lot of time and resources. But because there's a shortage of beds and staff, breaks are limited and working overtime is a certainty.
We're a caring profession. It's not about money for us, but respect and money do come hand in hand. We're not getting paid fairly for the sort of conditions that we're in. If we're doing the work of 2 or 3 nurses and I'm getting paid as one nurse, that just adds to that burnout, adds to the feeling that everyone's taking advantage of us.
It's not about how many ICU beds there are or how many ventilators there are. It's about how many people are able to go there and run them and to actually give you the care that you're going to be expected that you deserve. We need the public to at least be told, guys, the healthcare system is struggling. This is the new standard of care that you should expect, because we cop the abuse. Everyone's frustrations with the government and with the failings of the healthcare system comes back to us. That's why we have security walking our hospitals at all times. It's not to protect the equipment, it's to stop us getting bashed and beaten by the people that we go to work to protect and save.
Amy predicts another crisis unless healthcare workers get more help and get it quickly.
There are actually probably 10 nurses that I've stayed in contact with because I was genuinely concerned for their acute mental health. We really need people to push for nurses to have safe staffing put into law. It is about life and death.
1 in 4 to 1 in 5 doctors have suicidal thoughts, which no one talks about. There's plenty more statistics like that about healthcare workers, and that was before COVID.
Hand in Hand, a group run by volunteer doctors and psychiatrists, provides support for anyone in healthcare doing it tough.
There's this public health analogy, which is in healthcare we catch people at the bottom of the cliff, or, in some cases we don't even catch them. The idea behind Hand in Hand is that we want to put fences at the top of cliffs.
Hand in Hand is a part of the Thank a Healthcare Hero campaign, which also provides free food and gifts for staff in hospitals and testing centres.
The effects of COVID are not just going to go away in the next year or two. It's going to have long-lasting effects on all of us.
At first I was very angry and I really didn't know where to direct that. And then out of nowhere, Thank a Healthcare Hero reached out to me, and it was just this amazing sigh of relief. Like it was the first time I'd seen someone produce something that was a solution.
The nursing staff we spoke to were very clear. Support shouldn't just come from charities and volunteers.
I wish that our Premier, instead of saying that we're coping, could walk an hour in our shoes. Like, I would happily invite him to my hospital.
Having the people at top say, thank you so much, and then go to the cricket. It's just a slap in the face. We would love your hands in the hospital, pushing beds, helping us roll our patients, changing pads. We can train you. We can train our politicians to put on the PPE and come and give us a goddamn hand.
So well said. And the nature of the type of people that do healthcare work is they always put themselves second and everyone else first. And it's time as a nation we have to put them first. Like, what more proof? What more do we need? You know?
And also, how many staff did they lose under the vaccine mandates? It's putting even more pressure on them as well.
And then through isolation because someone gets COVID, they have contacts, and
I mean, there's not endless pots of money, but
no.
that is where some money.
Well, I thought she made a really good point. I think it might have been Amy who's saying you can't fund everything, sure, but then you've got to be able to communicate what you're allowed to expect, what you're entitled to expect. And that's where the mismatch is. If we expect something that the government's not funding, then there's something that's gone wrong there. And we either have to change our expectations, the government has to level with us. I think it was a really, really good point.
Absolutely. And if you want to donate to Thank a Healthcare Hero campaign, and it's not all up to charities, as they said, but it's a great help if you can, please visit our website for details.